let's kind of transition from regenerative to longevity. So that was such a great session yesterday, but maybe
Thank you.
differentiate those two and like, where are we going with this whole longevity play? It's so fascinating.
Thank you. Yes, it's so regenerative medicine and longevity science, they fit together. And you can kind of think of one as anabolic and the other one as catabolic. So I mean like yin and yang, okay?
Okay.
Regenerative medicine are builders. So they're like anabolic ways that we can help repair, restore, reprogram, renew. So it's
Okay.
all the positive benefits of how you build a house. But longevity science is about prevention. So this is about resisting damage and how you can prevent, slow down, or reverse the insults. So if you're thinking about a car, for instance, right? Regenerative medicine is the tires that you can replace, and the parts like engine, things like that you can replace, versus longevity science are like getting your oil changed, getting your tires rotated, just making
Right.
sure that you're reducing the predilection to damage.
Right. That makes
And
total sense.
yeah.
So talk a little bit. I mean, we don't just want to be living longer and have our skin. We want to be healthier, right? So
Yes.
talk about skin span and all these things that you kind of need to understand, I think, to differentiate these two disciplines. But I love that analogy. One sort of the build up, the other is the breakdown.
Absolutely. So skin health can be thought about over time. We want to preserve skin structure, but more importantly, skin function as we age as well. So how do we retain healthy skin aging over time, which we think about as a skin's health span, also known as skin span, which we've trademarked at Mayo Clinic. And this is the idea that we can preserve that skin longevity, both by helping it repair its natural ways that it does, but also increasing its resilience to stress.
So interesting. So do we think that at some point that we really can use topical skincare that will do that for our skin?
We are better understanding the root causes of aging and the root cause of skin aging. So at the cellular molecular level, what are these hallmarks of aging that we've identified that we can tap into and kind of biohack or bioengineer how we can resist damage better, right? And build that resilience over time. So I think we're definitely at a very exciting time in science right now where we can deep dive into these specific hallmarks, influence these pathways, and try to see how we can build better skincare around that.